The communities of people of color are always lacking. We're lacking resources, we're lacking funding for schools, there's food insecurity. And as we're coming out of the pandemic, I don't want to see my people get left behind. Hi, I'm Terri Sessions. I've been in Santa Clara County for 30 years. I'm a nurse at Kaiser, San Jose, and we were ground zero for COVID when it entered the United States. And so we were all very fearful. And I was offered the vaccine early on in its distribution. I was apprehensive and had to do research to find out how it was developed and how the testing was done. And I was pleased to find out it wasn't new research, it was based on a blueprint, and that 10% of the participants in the studies are African American. So I felt more comfortable. Our community, the African American community, is very fearful and very mistrustful of the healthcare system. We've had many abuses in our history with experimentation, and there's a lot of distrust, and I understand that. As someone who works in the community and someone who works in the healthcare system, I felt like me being one of the first people to get the vaccine was kind of taking one for the team. The actual vaccine was a piece of cake. It was totally painless. The first one, I didn't even have soreness in the arm. The second one was, I got the Moderna, and there was a little bit more of a reaction. I felt a little feverish, fatigued, a little headache, but it lasted 24 hours. The next day, I cleaned my house. I felt like I was COVID strong. I believe that it's safe. I wouldn't be sharing my information if I didn't think it was safe. I think people who see me and see somebody that looks like them will have more trust. I'm hoping that with my story, with my actions, with my example, that I can instill trust and confidence and encourage people to do the right thing, get the vaccine so that we can move out of this pandemic and heal together as a community. Sleeves up, Santa Clara County.